is Tuesday, July 6th. I'm Jessica Lovell, and welcome into the Morning Medical Update. Today, we are talking about the COVID-19, not the disease, but the average 19 pounds many of us gained during this pandemic. Our guests today are going to help us better understand our relationship with food. They are Dr. Gregory Nowalnik. He is the Clinical Director of Psychiatry and Behavioral Health here at the Health System. Good morning to you.
Morning, Jess.
Hey. And we also have Bobby McCumber. She is the Clinical Program Coordinator for the Bariatric Weight Loss Surgery Services here as well. She is also someone who knows a whole lot about gaining and losing weight. So we're going to talk with both of you here in just a moment. But first, we want to check in with Dr. Dana Hawkinson, of course. He is joining us with our COVID count. Good morning to you.
Yeah, hi.
Hi.
The COVID-19.
The COVID-19. I got that part handled. You got the real COVID handled today.
From the coronavirus. Our numbers today have been going up since the weekend. Unfortunately, today we have 22 active infections with 7 in the ICU and 2 on the ventilators. It should be noted that in the ICU, we do have 85% of those people that are in the ICU right now, and that is 7, are unvaccinated. So again, the vast majority of these people that are in the ICU are unvaccinated. On the regular floors, we have 75% of those patients are unvaccinated, and that includes actually 2 patients in their 30s as well who are unvaccinated. So again, the real theme to this story is get vaccinated, because if you get vaccinated, your risk of coming to the hospital, seeking medical care, going to the ICU is significantly less than if you are not vaccinated.
What do you make of this sudden climb this time with COVID numbers? What are your thoughts on that?
I mean, I think it's a combination. Again, it is probably the Delta variant. We have to assume that really most all of the isolates are Delta at this point, just based on the velocity that we know that the prevalence was increasing of Delta variant. That coupled with all of the lessened restrictions, and people have been out not masking, getting together now for a few weeks, and so that behavioral thing is just increasing the spread as well.
It's just all part of it. Dr. Nowalnik, I know this creates a lot of anxiety for people, so I'm sure we'll have some questions for you about that as those numbers kind of creep back in.
And, luckily for our rural partners, Hays only has 1. That's really good compared to some of the other rural counties that we've seen around Kansas and Missouri as well.
All right, so before we get to today's topic, we want to go ahead and, we know we have some reporter questions today. Jill, do you have some first?
Well, I'll wait for those on the line.
I think we're good to go.
Okay, yeah, we do. Brian Johnson with Channel 9 has got 4 questions, or 5 here, and I think I might have heard a reporter trying to come on, so we'll get to you in just a second. With the Delta variant, should vaccinated people go back to wearing masks? He points to the WHO and the CDC, who seem like they have conflicting information or guidelines.
Yeah, I think we all number one, have to remember World Health Organization has to deal with the whole world. So they are dealing with countries that don't have as much is not as fortunate as the United States in the fact that they don't have as much vaccination. They also have a lot more people who are living in conditions that are closer to each other. That was one of the initial things why they had come out and said 3 feet instead of 6 feet. So there is that action there, and those reasons for stating that. The CDC, we know Dr. Fauci has also talked about it. Again, it starts to be a risk tolerance. Right now, they haven't made any change in guidance about masking, but understand the risk and what you're going to be doing. If you're outside, obviously that's going to be much safer if you're vaccinated than if you're doing something indoors with people who you have to assume not 100% of the people that you're around are vaccinated. So I think at this point there is no change in guidance, but overall we know what will help protect us, and that is masking and distancing and doing those things even if you're vaccinated. So that kind of will boil down to your individual risk tolerance at that point.
How likely is it for a vaccinated person to get it or spread it?
Yeah, well, there's not a lot of change in the chance of getting it per se. It's just going to overall, the vaccine is just going to overall decrease that whole spectrum of disease, whether it's asymptomatic disease, whether it's a slight cough or sore throat for a couple days, but especially going to the hospital and severe illness. So getting the vaccine will definitely help reduce all of that. We know that the vaccines are working against Delta variant. We do have an immune response that does help to protect us from the Delta variants and all the variants right now that we have seen. So that is from the J&J vaccine, that is from the 2 mRNA vaccines. We know that there is good evidence suggesting that we still have really good immunity towards Delta variant. There's some just new press release from Israel stating maybe the Delta variant in vaccination isn't as good as previously thought. But again, this is early information. All the information we do have right now would suggest and would say that we have a pretty good immune response against protecting us from those higher levels of disease from Delta variant.
Yeah, I heard on a news report today, too, that they said they wanted to look at how that information, the Israel report, was gathered.
And I think the part of that in Israel is also, remember, just like here, restrictions are lessened, people are meeting more, that the virus is just going to be spreading more because of those lessened restrictions.
Okay, so Channel 9 has a few more questions. One of them is, so how concerned should a vaccinated person be?
Yeah. I mean, I think your level of concern still has to be pretty low to minimal. Again, we have really good, much more evidence to say that the vaccines that we are giving right now offers good protection against Delta variant. But I think that being said, continue to do those smart things, understand the risk, where you're going, what kind of situation are you going to be in. Do those things to protect yourself. Just what is your risk tolerance? But I think overall, if we continue to get more and more people vaccinated, and we know that people here in the metro community, we have much higher rates of vaccination than, say, some of our rural neighbor communities. If we can get everybody vaccinated, whether it's in the KC metro area, all of those eligible, so everybody 12 and under, whether it's in the metro area or in those rural communities, that is overall going to be helping. And then that will help reduce the risk overall if you are going out to some of those situations and out in public and doing those things.
And Brian also asks, how much more contagious is the Delta variant? Are you predicting a spike after we get past the 4th?
Yeah, I don't think we really have quantified how much more contagious or transmissible Delta variant is. The same thing has come up with other variants. I think a better term is how fit is this virus now, this variant, this Delta variant. And by fit, what do I mean? Well, does it replicate more when it does infect you so that you're expressing more onto the environment? Does it stay replicating? Do you shed longer than normal? Does it have properties within its genome that help us to reduce the immune response or evade our immune response? So I think that's more of a question rather than how more communicable or transmissible is, how more fit is it? We don't have all those questions. We certainly know from Alpha variant we have a little bit more information, and that's been around longer. And we've seen that has been able to help reduce some of our immune response when we get infected with that. So that is just a little bit of the basic science. We are still trying to learn about that. But again, continue to be vaccinated because we know vaccination does offer protection.
Okay, so one more variant question, and then he has COVID disease question, and then I think we're done with Channel 9. But Brian is asking if COVID-19 variants have mutated enough that vaccinated people are getting sick, then has it mutated enough that all the people who were previously sick from COVID could get infected again?
I think, I'll start with the first question. We do understand that especially if you had asymptomatic disease or low severity disease, your immunity towards any of the variants is probably not as good as vaccination. So vaccination is still required, still needed to help protect yourself if you were infected prior to any of the variants. There's not a lot of evidence right now about that it's mutating or changing to the point that we don't have immunity, especially from vaccination, and that is because of those conserved or stable regions that don't really change or mutate on that spike protein. And that is what is giving us, number one, some antibody levels towards those, but also our T cell responses to help with immunity, with protecting us from that severe disease as well.
All right, and then refresh our memories. COVID, when you get it, how long should you quarantine? That's one.
Well, if you get COVID-19 or if you are symptomatic, you should isolate, not quarantine. Isolation is generally 10 days from when symptoms started or 10 days from when you got tested and you were positive. Unless you develop symptoms, then that isolation, 10-day period of isolation has to reset.
Okay, and Brian's last question is, when is a person with COVID most contagious? Gosh, give me some coffee. When is a person with COVID most contagious? He also says that he personally knows 4 people that were fully vaccinated who have COVID and had symptoms.
Yeah. And certainly we know breakthrough disease can occur in those that are vaccinated. Again, what is the main point of vaccination? It is to overall decrease that whole spectrum of disease from mild symptoms all the way up and especially to hospitalization and severe disease. How long are you symptomatic? So before vaccination, what we were saying, or how long are you most contagious? What we were saying is probably 1 to 2 days prior to symptoms to about 1 to 2 days after symptoms start. At that point, your body has kind of kicked in the immune response, and the amount of virus that you're shedding goes down from there. So it's really, that period of maybe 4 or 5 days, which is 1 to 2 days prior to symptoms to 1 to 2 days after. After that, your viral load certainly decreases. The amount that you're shedding into the environment decreases as well.
Okay, so that wraps up our reporter questions for right now. We do have a lot of community ones, I can see.
Hi, Heather Hollings.
But now, Heather is on the, go ahead.
Hi, Heather Hollingsworth with the Associated Press. I have a question dealing with transfers from some of these rural hospitals, and particularly in Southwest Missouri. I know that the Springfield Hospital saw a huge spike over the weekend. What are you seeing in terms of some of the overflow from some of those really hard-hit parts of the state? And what are you anticipating happening going forward as that outbreak continues to intensify? Their projections show their numbers continuing to go up for the next month.
Yeah, all I can say is anecdotally, and speaking with one of the executives yesterday who's working on those transfer calls, we have received transfer calls. Not all of them have been with COVID. Again, once your hospital fills up or your institution fills up, there are other people who are still coming to those institutions for regular reasons, for heart attack, for other types of pneumonia or infections or other reasons. So we take transfer calls because of those things, but also with COVID. We don't have our specific numbers from the weekend, but we know we have been getting transfer calls not only from the Springfield area, but a couple other rural areas in Kansas and Missouri as well. And that is not a new thing. We do and have been taking transfer calls for different disease states for quite some time. But obviously, if you are in one of those rural health areas and you do have capacity issues because you have so many COVID patients, then you are going to need room and places for your other sick patients to get treated as well. So we don't have our full numbers just yet from the weekend, but we know we have been taking some transfer calls for that purpose, for COVID, but also for other common medical issues as well.
I do have a note here from Scott. Hold on one second.
One more question. This still
hold on.
You mentioned 75% of the patients in there have been vaccinated. That indicates that 25% have not been vaccinated. Is that a new thing with this Delta variant, that you have such a high number of hospitalized patients who have been vaccinated?
No, 75% have not been vaccinated.
Yeah, so that indicates that 25% of the patients you're treating have been vaccinated, correct?
Correct, yep.
That number seems high. Is that different than what we've seen previous?
So this is
attributing to the Delta variant?
This is for the medical surgical floor. So a couple of those are not even symptomatic. Some of those are symptomatic of those vaccinated patients. But again, that's not unexpected. Overall, the vaccines, again, protect you from mostly hospitalization and that severe disease, but it also protects against the wide spectrum. Again, 75% on our normal medical surgical floors, not the ICU, are unvaccinated. This is not unheard of. We do understand this will happen. The vaccines don't protect 100%. And I think moving forward, right now, what we've seen from the velocity of change of the prevalence, meaning how fast is the variant increasing around our metro area, around Missouri and Kansas, I think we have to assume that all of these variants right now are probably that Delta variant as well.
And then
does
Heather,
that
I wanted to
help?
clarify for you. Scott said that, and Scott is over our transfer center. He said Springfield area includes Joplin, Branson, and Carthage. That is their usual transfer locations. So when media asks, did you get somebody from Springfield, and that's what we go search for, it may not be reflective of also what's happening. He said we did take a Carthage COVID patient yesterday, and we declined a Joplin ECMO patient yesterday. Why might we decline an ECMO?
There could be various reasons. You know, we may not have the ability to have the ECMO right now if our ECMO machines are taken up for one reason or another. Again, we use ECMO machines not just for COVID, but other things as well related to the heart and lungs. So it could be at various reasons why we didn't accept that person.
Okay, Heather, do you have follow-up questions?
Well, I just a little clarification on, you said per this, the percentage of people who have been vaccinated and not vaccinated. You said, okay, so 25% on the floor have COVID and have been vaccinated. But that is that just because you're routinely testing everyone who comes in and they're not necessarily there just for COVID symptom? Is that the distinction you're trying to make? I didn't follow what I think you were trying to explain something more with that, and I didn't understand it.
Yeah, I mean, we're still screening everybody who comes into the hospital. We've been doing that for a year and a half right now. We are still doing that. So we do have people that are vaccinated, that don't have symptoms, that are testing positive because they're here for another reason. We also have other people who are vaccinated, who have symptoms and are coming in because of symptoms. But they could also be coming in for something else, may still have symptoms, but also related to other things that are testing positive as well. Again, I don't think it's a huge issue that 25% of those people on the medical surgical floor that are positive have been vaccinated. Vaccination protects against that whole spectrum of disease. So if they weren't vaccinated, who knows where they could be. They could be having worse symptoms. They could be in the ICU. The vaccine is offering the protection. But I think the important thing, again, 85% of people in the ICU and 75% of the people on our regular floors are unvaccinated. So if we could have vaccinated those people, there's a very good likelihood they would not be here at this point with symptomatic COVID disease.
Let's talk weight loss.
Oh.
I'm very interested in this.
Or weight gain for many people, must we? All right, so you don't go anywhere because you're front and center today. So
I guess
know
I'll stay here.
You will stay right there. Community will have many questions for you, I'm sure. Okay, so all week we are talking about gaining and losing pandemic weight. So tomorrow I am super excited to introduce you to a man I met before the pandemic. His name is Brian Mann. Very inspirational. He lost 80 pounds just changing how he cooked at home. So we're going to find out if he kept it off during the pandemic. So many of us have found comfort in the past 18 months with, what else? Food. In today's Morning Rounds, we found out by talking with some folks on the plaza. See if this sounds like you. So let's find out how people fared weight-wise over the pandemic. So did you gain or lose during COVID?
I gained.
You seem very sad about this.
It is. It sucks. Like, I gained the COVID-20, not the COVID-19.
You said you were sucking it in a lot?
Yeah, you don't need to pan down for that. Just keep that camera right up there.
Okay, so did you gain or lose?
Gain. I don't know, 10 pounds maybe, because like the gym was closed for a long time.
My husband and I went on Weight Watchers, and we actually lost weight. But then once we got out, and we went to Florida in the winter, then we started putting it back on because we weren't at home, you know.
Some vacation weight?
Right, vacation weights.
You know, I also avoided jeans for most of the pandemic. I've been working from home, so I've been doing the leggings and pajama bottoms.
You guys look young and fit. Did you lose? Did you gain over COVID? What?
I didn't lose or gain any weight. Although all I ate was fast food, I stayed the same.
No fair. That is no fair.
I gained 10 pounds. Wish it was less, but...
Okay, so did you gain or lose? What were your habits like over the pandemic?
Stayed same. Actually, I'd say probably a little healthier. 'Cause we actually took on cooking as a family project.
Didn't lose any. I've been working through the whole thing, and I gained more muscle than I did anything.
You're bragging now.
No, it's the truth.
What happened over the pandemic for you? Gain or loss?
Gain quite a bit. I think it was like between 12 and 15. Yeah, but I'm trying to lose it now.
Did you gain or lose weight? Be honest.
Gain weight, 11 pounds.
Wow, you got that down to the pound.
Yes, because I'm very upset.
Well, what are you going to do about it?
I'm exercising and watching what I eat after I leave the Shake Shack.
Now that I can get behind.
I would say that I lost weight. I didn't eat as much as I normally would. I didn't go out.
I stayed about the same, actually.
We're actually sisters, so we moved home from college when quarantine started, and we lived at home, so our mom got to cook for us. So it was really healthy food, and then we got to go on runs together.
What was your favorite thing to eat?
Oh my gosh, anything sweet with sugar. I had to find my, endorphins somewhere, so I was like, sugar it is.
What were you eating during the pandemic?
What wasn't I eating? Just whatever was available, whatever was handy.
Whatever you could get in your mouth?
Oh yeah. If there was chocolate involved, chocolate helps a lot.
You lost weight eating fast food and sitting around?
You lost weight eating Popeye.
I think I went to Popeyes probably 4 to 5 times a week.
Now what are you doing to try to get it off?
I've been doing a lot of walking, honestly. Like I got an app where the exercise is currently paused, but
No chocolate. That is strict orders from me.
Okay.
Do your best.
Okay, I'll try. I'll try.
Okay, I love that guy.
Yeah,
I think
great.
there's a little bit of him in all of us.
Yeah, so how do we get him here?
Yeah, right. Okay, so we want to turn to our guest today, and you are not exempt from this conversation. I know you work out a lot, but I'm going to try to find out. You had to have lost or gained something during the COVID, so we'll find out.
Maybe.
We'll see. Okay, so we want to find out, and I know I identified with a lot of those folks that I talked with down there, but by and large, and yes, that was a pun intended, it seemed like a lot of women were confessing to gaining weight. Men say that they didn't really gain much. Are they lying to themselves, Dr. Nawalnik?
Well, all right. So if we're going to get into the science of this, I'm not going to say anything about comparing the genders on that. That's a losing battle that I don't need. Realistically, we know that evolutionarily speaking, there's some data out there that bears out that when stressed, women tend to be more likely to turn to food as a cope, whereas men will turn to alcohol and cigarettes.
Okay.
Kind of a crazy thing. There's also research out there that says it's not the case. But I think that looking at that piece, it may have just been different stress impacts. Some people, I think, speaking to the fact of how much that one guy was working. And I think that one really important point there that the one young woman made is that, when you left the office, you stopped having to put on proper work clothes. And so that removes one gauge that we kind of have to track how we're doing with our weight. Like, when you're closing pants and it starts to have resistance and it meets a little more than it used to in the terms of flight, that gives you that indication that, hey, maybe it's time to pump the brakes. When we're wearing elastic all day, every day for a year, I mean, elastic is your best friend, worst enemy. It's a double-edged sword of the first degree. So that, I think, could have been at play there.
All right, so why then, and I want to bring our guest also, Bobby, into this conversation as well, but why don't we turn to the carrot sticks? Why do I not crave the carrot sticks? Yesterday, my kids made me buy Cheetos at the store, and I think I may have taken down half the bag. I don't know, maybe it was starting this new show today. I host Stress Eating. So why do we do that, Bobby? Why do you think we don't go for the good stuff? Gosh, I wish we did.
Or probably like that girl said in the video, like the endorphins that you get. Sometimes some of those foods kind of speak to your brain differently than the healthy food and release those endorphins and kind of give you that sense of happiness or some energy or something that's short-lived.
Yeah, for sure. Cheetos definitely make me happy, Dr. Nawalnik. You say you kind of touched on it. There's kind of a caveman connection. I love it when you tell this story.
Sure. Whenever we think about anxiety, and we go back to our ancestors, that's where anxiety comes from, is during the evolutionary period where we were having different adaptations to try to live with and cope with the stresses of our environments. Food was scarce. So we didn't have the ability to get bored and eat. It was really an issue where our body determined stress as one of two things. One, something was going to eat you, or two, you weren't going to be able to eat for an extended period of time. So we developed this kind of tool to deal with that, where we would try to eat as much fat, sugary content kind of foods, things that would help us to pack on weight so that we could sustain ourselves for a long period of time between meals. When we get to that place of nowadays, when we have chronic acute stress, we're not going to eat. That comes down to the idea of the thing that's going to eat us. So when there's something that is really in the moment, we're having a real stressful time, that's when we're going to be less likely. You kind of get that sick to the stomach feeling. But in the presence of chronic stress, where you have an ongoing situation, maybe something like, I don't know, a global pandemic, that is the type of situation that's going to cause us to go into that other response where we have more cortisol in our bloodstream. And that is something that's going to cause us to reach for all those unhealthy foods, the cakes, the Cheetos, whatever it might be. And in the short term, we get a little lift from it. And so it becomes habit forming, and that's where we wind up in the problem. And it's an instantaneous choice that we have to make. Unfortunately, it's a lot easier to make the instantaneous choice that makes us feel better rather than delaying that and saying, you know what, I'm going to think long term here, and let's not grab and house a half a bag of whatever. Not that I haven't done the exact same thing.
What are you saying? There's no cheese and Cheetos? Is this what you're saying now?
I'm saying that last night when my boys were going to bed and they can have cheese after they brush their teeth. That's it. My one son says, I'll have Cheetos. I'm like, you're not having cheese puffs. That's not cheese.
I'm telling you, they are addicting. See,
Yes,
you were the same thing. Okay, what was Dr. Hawkinson? What was your go-to? Did you have a thing you if you found yourself in a pantry or eating something? What was your thing? Pizza? What was it?
I don't know. I like Sour Patch Kids.
You do like Sour Patch Kids.
So we can all get bored and watch YouTube and eat Sour Patch Kids.
Perfect. Okay, Sour Patch Kids.
Or the Marvel movies. I don't know.
Okay. All right. That's good. That's a good advice. Okay, Bobby, I want to ask you, because you had your own weight loss journey. Tell us a little bit about that.
So I never really struggled with my weight until I turned about 30, and then I gained a whole bunch of weight, some health stuff, some medications, and things like that. And so I decided to have bariatric surgery. So I had a gastric sleeve. And over the course of about 9 months to a year, I lost 115 pounds. And so with that, bariatric surgery is more of a tool, so you still have to learn all the same habits that you would if you were going to lose weight without that tool. And so now I'm 3.5 years out from my surgery, and I still have to really watch what I eat. It doesn't do the work for me. It helped me in the beginning, and it helps me control how much I put in there at a time, but I still have to make the decisions to eat what I should eat at a time.
Well, and we're going to talk more about medical interventions when it comes to weight loss coming up later on in the week on Thursday. But, Bobby, you say that writing it down really matters. Tracking your food, your liquids, water. Tell us why that was so helpful for you.
Yeah, so I use an app on my phone to track my food still, because you just don't realize what is in some of the foods you routinely eat. So, for example, my coffee, I love coffee, and so some of those really fancier, fun coffees have a lot of sugar and calories in it, and it's a lot of wasted nutrients and space in my stomach, and things like that. So I track it, then it tells me how much protein I'm getting and how many, if I'm getting my vitamins and minerals in, and it keeps me aware. So there's just so many things, like just your condiments and stuff that are empty calories that you don't realize how much you're really taking in until you write it down.
So you've been doing this for a few years, but what kind of effect did the pandemic have on you, just as you were trying to keep the weight off?
Sure, yeah. So I definitely kind of went through a lull where I wasn't real good about tracking my food, and then I did work with the employee tracing team during COVID because bariatrics wasn't up and running for a little while. So people were bringing us all this great food, like appreciating healthcare workers, and we're getting cupcakes, and we were getting things that I don't usually eat, and I did participate in that and gained about 10 pounds. So here recently I'm back on track, putting everything back in my app, making sure I'm drinking my water, about one of those giant jugs that hold 64 ounces to make sure I'm getting all my water I need in a day. So just kind of reel it back in.
All right, so I want to take a minute just to talk about some weight gain research that was done during the pandemic and what it shows. Now, the people we heard from earlier in the update talked about gaining somewhere between 10 and 15 pounds, but a small study published in JAMA in March of last year showed more poundage. The study looked at 270 middle-aged men and women across the country from February to June of last year. Now, during that time, the average weight gain among that group was about 1.5 pounds a month. So that would mean for most people that they had become overweight or possibly even obese, not counting the weight that they may have been carrying as they went into the pandemic. So, Dr. Nawalnik, losing weight is one thing, but to me, kind of what Bobby was touching on, just like the anxiety of keeping it off seems like a whole other mountain to climb, a whole other separate issue.
Yeah, it is. And when we get into obsessing over our weight or appearance, it's another level of the anxiety. And so, the research, some of the stuff that I reviewed and preparing for this showed that, that study or that data, when you talk about people who are likely to gain weight as a response to stress, if you are already overweight, you are put in a higher risk category to, obviously numerically to slip into obesity, but also you're already wired, whether it be genetically, behaviorally, and you have to consider both those factors at all times, to slip over and to use food more as a coping strategy than somebody else might be. And so that's really kind of interesting, but there can be a lot of anxiety for people. There's a lot of shame around weight gain. And when we're making choices, we spoke earlier about the fact that short term, it can feel better. It's afterwards, when you're lying in bed at night feeling really full and uncomfortable, that then this kind of shame and depression comes in. And so anxiety and depression really often go hand in hand. And I think that when we talk about weight gain, and certainly in the background of the pandemic, it's absolutely a dry tinder for a forest fire.
And you mentioned that alcohol kind of played the same role for many people during the pandemic.
Yeah, and that's a big thing to not discount, is that when we talk about gaining weight, a lot of folks, even in that segment, said, I kind of ate the same, I didn't really change anything, and may have still wound up gaining weight because they're not counting the caloric intake in the drinks that they were adding in routinely each night. And so a lot of folks kind of made their way through by recognizing, well, it's 5 o'clock somewhere, and so I'm going to pour, a drink or have a beer, have whatever. And then as we go on, our tolerance increases, and so our intake increases. So whereas initially it might not have made such an impact because you're having maybe one drink every few days, if we start shifting to every day you're having a drink, then it turns in every day you're having a couple drinks, the calories start to add up, and so does the weight. My family, we decided when the pandemic hit, we just cut out alcohol because we realized we wanted our immune systems to be functioning optimally. And as a depressant, alcohol does negatively impact your immune response. So it wasn't something we set out like, oh, we have a drinking problem or anything like that. But just from cutting out alcohol for a few months, I dropped 15 pounds, and that's significant. So maybe I was drinking more than I wanted to admit. I don't know. But either way, making a simple behavioral change, and I think that Bobby makes a lot of great points there talking about the specific behaviors of weight loss and things that we can incorporate, like writing down what you're eating, tracking the actual calories, and actually being mindful. It puts a step between that impulse of, I want to eat this, and makes you actually engage the prefrontal cortex, which is that inhibitory response. It's the part of you that says, hey, hang on, you like the way your clothes fit when you're a little slimmer. Is this really what we want to have right now? Do we want to derail this whole plan? And so anything that we can build in between the impulse and the act is going to help. And engaging that thoughtful control and that ability to say, hey, let's just take a break, and the impulse will pass. That's the crazy part that people don't realize. They think, well, I said I didn't want it, but it's going to come back and ask me again. I'm going to have it then. These are all immediate moments where you can insert change. And so it's about making an active choice and taking the right steps. And when we get stressed, you're probably going to ask me about it, but when we get stressed and we look at maladaptive coping, eating, drinking, whatever that is, if you could just go for a walk, I know that sounds ridiculous, but deep breathing, meditation, and exercise, as something as simple as just a 10-minute walk, a couple times a day will make a world of difference. And it's a communication to yourself. It says that you're worth making a positive change. And that's really how this stuff happens.
We're going to get to community questions here in just a moment. Congrats on your weight loss. I'm glad you brought it up because I remember you came in and you were like, Jess, my pants are fitting differently. My jackets are fitting better. So that was good.
I wish they still fit exactly the way they did then. But I think as summer hit, but we're working. We're all right.
Oh, that's fantastic. Did you gain or lose? Please say you gained something.
I don't know.
You don't know?
I don't weigh myself.
You don't weigh yourself. Okay.
Maybe once every 6 months.
But did you feel? I know you take care of yourself. Did you feel healthy? Did you feel like you were being mindful about?
I tried early in the pandemic. I was walking like twice a day.
Yeah.
And I think my alcohol intake went down actually because I wasn't going out and doing those.
Yeah, no, we weren't being as social. We've talked about that.
Yep.
Weren't being as social.
Right.
So, okay, so Jill, are we ready for some community questions? I know we'll probably have some COVID ones and some the COVID-19 and COVID-19 questions. What do you got?
We do. So Rita, on topic, Bobby, she wants to know, what is the app that you are using?
Well, because I had bariatric surgery, I used the Baritastic app, but there's several out there. I mean, Fitbit has an app. There's many out there, so whichever one would work best for you. But because I've had surgery, I use the Baritastic app.
Okay, and now we have some COVID questions, and Dr. Hawkinson, you've answered a lot of these, but here's a few that we didn't get to this morning.
Okay.
Zach wants to know, do you have updates on the timing of vaccines for kids?
No updates as far as I believe this question's going to be geared toward the 12 and under. We're hoping it's before the school season starts, before the new school year. We know those investigations are ongoing. Just as everything has been expedited around the vaccines, I would imagine this would be expedited as far as data collection, data analysis. So hopefully, maybe within these next 4 to 6 weeks, maybe by mid-August. I know some other people initially have said maybe it won't be till early fall, but with any luck, hopefully, because all of these vaccines have really shown to be very safe. I expect that they will be very safe in children as well, but we really need to get that data and analyze it, and then maybe sometime after August 1st would be a good time, but I know we're all still watching.
Yeah, and I think Dr. Pahu's going to be on with you either next week or the week after. I don't have that calendar.
And she would be
I think it's next week.
the expert to have a better kind of feel on it.
Yeah, so she's going to be on, so keep those COVID and kid vaccination questions handy because she'll be back and we'll let you know. Melissa and Marilee, hi Marilee from Skidmore, good to see you again. Melissa and Marilee kind of have sort of similar questions. They're asking about breakthrough infections.
Yeah.
And the question has to do, of the ones that are vaccinated, that you're having the breakthrough infection, are they getting real sick? And Marilee wants to know, I think what they're saying is, tell me they had comorbidities.
Yeah, so we have seen throughout this time when vaccinations became prevalent, we have seen breakthrough infections. We know the CDC has seen breakthrough infections. They have stopped looking for breakthrough infections unless you're hospitalized. Anecdotally, here at the health system, we have seen breakthrough infections, but yes, those patients generally are older, so 65 and above, and they most all the time have comorbidities. And other comorbidities that I'm talking about are heart disease like heart failure, previous heart attacks, lung disease like COPD, diabetes mellitus. A lot of them have all of those things. So they do, most all of these people who we're seeing with breakthrough infections in the ICU or more ill on the floor do have these comorbidities that we're talking about. Unfortunately, it's those unvaccinated healthy people in their 30s, 40s, and 50s who we're seeing on the floor and in the ICU as well, who don't have comorbidities. So, kind of going back to that first question from one of our reporters, that's why it's so important to be vaccinated, because the vast majority of our patients here are unvaccinated.
All right. Good morning, Isaac. He has a question. He said he went to Oceans of Fun over the 4th of July. Great. He said he's fully vaccinated. He just wants you to say, how safe was I? He said there was a breeze. He goes, I'm feeling pretty safe, but
Yeah, I think it goes back to being outdoors, and we know there's turbulent airflow, and especially if there's a breeze, any virus that is expressed by people who are there is probably going to dissipate pretty quickly. You're not going to breathe a lot of that in. So again, I think the outdoor situations are going to be a lot better. Your risk is probably minimal, especially if you're vaccinated.
Okay, and Gene, who he may have missed the first part of the show, he said we've been going on 90% effectiveness for the vaccines. Today, there's news indicates 75 to 85%. Does that mean masking should be advised in more situations outdoors as well as inside?
Yeah, I mean, I think that could be a way that we're moving, but it's not. It may not be a general United States issue. It may be more localized. And what are those infection dynamics where you are at? Now, obviously, if we were in Springfield doing this, it would probably be a good idea to continue masking and distancing as much as possible. We know here in the metro area, I think about 70% of our eligible population is vaccinated. I could be a little bit wrong, but I thought I saw that today in the Kansas City Star. So we have a higher amount of vaccination. Our infections and our total cases and positivity rate is lower than in Springfield. So I think moving forward, it will be kind of what are your local infection dynamics like? That includes what is the vaccination rate, but also what are the amount of cases and spread. But again, right now here in the metro area, if you have that concern, then it's always okay to be masking and distancing as much as possible as well.
So I'm going to let Ross have the final comment that leads me to a question, and it's back on topic. Ross, he says, I want you to know I gained 25, not COVID-19, but he's lost 16. So he's on his way down. Way to go, Ross.
Right.
Yep. Ross and I are kindred spirits. He said it's cookies and ice cream. And for me, it's anything sweet at 9 p.m. Why then? I can do good all day long. What is happening to me at 9 p.m.?
You asking me?
Yeah,
Okay.
anybody.
I mean,
any of our weight loss people.
Yeah.
It's largely boredom. We hit the end of the day. We don't have the 15 demands swirling around we've got to deal with, and so our mind just seems up and says, you know what? Cookies are pretty great. Wouldn't those be great right now? And it's funny. I was actually talking to my wife about this the other night. We sat down, like once the kids are in bed and everything's done, we turn on the TV, and I'm like, why do I really, really want popcorn right now? Like, I mean, it's just, and we'll house a whole bag. And so this time we didn't, and I was just fine. But, it's just a choice that we have to make. And I think that recognizing that evolutionary piece where our brain, this antiquated hardware we have, thinks, it doesn't understand the idea that we can just go to a pantry, 10 steps away. And the other thing is we used to be a lot more active back then than we are now. So when we're just lying in bed and eating stuff right before bed, we're ripe for disaster right there. So.
And my final question is it true that anything I do, Bobby and Dr. Nawalnik, for 30 days will make it a habit if I can just get through 30 days?
I think so. I mean, I think even with the tracking, kind of like it helps you recognize those behaviors that you have, like eating at nighttime, and you can recognize why you're doing it. And so I think it helps you build better habits going forward because you're actually seeing what you're doing and correcting those issues.
And to jump on that is also, it used to be 2 weeks is habit forming was the statement. And Jill, you're way on your science that, it's now been shown as more 30 days. But I don't want people to get hung up on 30 days. It starts with one moment. It starts with a day. It's stringing together into a week, a couple weeks, and it becomes habit forming, but that habit won't start if you don't take that initial step. And so that's kind of the most important thing is making the decision, taking the first step, and then actually giving yourself credit for it, and also giving yourself grace that if you make a mistake, it's okay. We don't burn the whole building down. Let's just keep going, get back on track.
Well, and Jill, if I can just say, you and I talk a little bit about weight loss here in the office quite a bit.
For 20 years that I've known you.
Right, for 20 years that we've known each other. We're always sharing tips. What are you doing? What are you not doing? What should I be doing more of? Which, Bobby, I just wanted to ask you, because Jill, you were saying, like, I did this and I only gained 1 pound. And I told you, I said, it is 1 pound matters. So, Bobby, just what's your thought about just how that 1 pound leads to pound number 2 and pound number 3? It's not like you wake up 2 weeks later and say, wow, I just just lost 20 pounds. You know, well, unless you're a man, of course, you probably do. But for like women, it just seems like 1 pound should really be celebrated.
Yeah, I mean, kind of like he was just talking about giving yourself some grace and celebrating even the 1 pound, because, you know, I don't know if you've ever seen a picture of 1 pound of body fat. It's substantial, just 1 pound. So I think it starts there in celebrating your 1 pound, celebrating your 5 pounds as it continues to grow, and then it becomes more of a habit, and you kind of get out of those behaviors of kind of putting yourself down and shaming yourself, and it grows and you become more successful.
Jill, 1 pound at a time.
Yeah. And by the way, I know Grace really well.
Good friend, huh?
Yeah.
Okay, so
I'm too often going to give myself grace.
Give a lot of grace. That's a good one. Okay, so let's move on to our final thoughts. So, Dr. Nowalnik, let's you get us started. What's kind of your words of wisdom as we head out today, this week?
You know, I think as we come out of a holiday weekend, this is a great time to really dive into positive change. I'm sure people probably made some questionable choices. There was probably a lot of potato salad, a lot of great desserts, a lot of things being passed around. Don't get upset about that. That's fine. Now, if you want to start to turn the ship around, it can start today. And like we said, you know, give yourself grace, but also recognize that you are your purpose. You're your reason to make this change. And you're not doing it for anybody else. Don't worry about anybody else. This is between you and you. And so if you decide that this is a road that you want to travel, it's up to you. And it's an all-day, everyday decision. And you will find your comfort zone, and you can make this happen. So go get them. Good luck.
Love it. That was deep. I like that.
Thanks. Yeah.
Okay, so don't forget, we want to tell them about the event for the Royals out on July 27th. It's a big day for the Royals fans interested in learning more about mental health awareness. Tell them what they need to know.
Yeah, this is a huge deal. This is the first time ever that a Major League ball club has invited in mental wellness as a topic of discussion. I mean, we've seen all the different cancer nights and different events, but this is the first time that finally something that really so deeply impacts so many folks in our country, we can actually have this conversation. So kudos to the Royals for taking this step, and we're really excited to be a partner and be moving forward with this.
So you can stop by Gate A. There's prizes. Again, learn more about mental health, wellness, and then $5 from each ticket is going to go to help folks at Marillac. Tell folks what Marillac is.
Marillac is our child and adolescent mental health inpatient facility. It really does a lot to help try to improve the lives of the kiddos in our community. So really big deal.
Okay, so also tell folks that they might see you out at the Crown Vision at the game, up on the Crown Vision. Tell them a little bit about this photo, because you were interviewed by Ryan. Am I saying his last name? I'm going to mess up his last name.
Lefebvre.
Lefebvre, okay. Yeah. So this was part of the Shut Out the Stigma campaign. So just in general, Dr. Nowalnik, how important is it that light is being shined on mental health just by professional baseball?
You know, this is really essential because people look at Major League ballpark, you know, at times and the teams and everything, and they think, you know, when you go to the game, there's no issue, nobody has a problem, everything's great. And so to be able to have these conversations and have this dialogue, and for Ryan to be as gracious as he was to have me on and have this discussion, it was really very powerful and impactful. And I think that if it does nothing more than prompt some conversation around it, so that on the way home from the game, maybe somebody says, hey, you know, you've been kind of quiet lately, how you been feeling? And it allows that person to open up and feel validated and feel important and feel that they can actually share some of what they've been carrying and unload that. This can be a pivotal moment and really make a big difference. And I also want to throw out that Carl's Cause is one of our partners who's also going to be there that day, and that's a great local charity that works on suicide awareness, and so we're so excited to have them there to partake in this and take mental health awareness to the stadium level. It's a big deal.
Really, really important.
Yeah.
To be out there talking about that is
Yes.
great. So again, that's part of the Shut Out the Stigma campaign. A very great cause. Okay, so Bobby, I'd like your final thoughts. Just kind of what is your insight? What do you want to leave our viewers with today as they head out there on their own weight loss journey?
I would probably just mimic what Dr. Wolnick had to say about being positive, and maybe just take it one step at a time. Like, make small goals so that you can celebrate those goals and grow. So maybe drink more water is your first goal, maybe eat less sugar is a goal, whatever that might be, and really conquer that and then build on that so that you can stay positive and focused and really be successful long term.
Thank you so much for sharing your story today, Bobby. We appreciate it. Dr. Hawkinson, wrap us up.
Yeah, I mean, the variant is out there. Assume, all these cases now are probably due to Delta variant. We still know the vaccinations offer good protection. We would like all of our rural community and neighbors to get vaccinated, get good vaccine uptake. We have pretty good vaccine uptake here in the metro area, but it still could be better. If you aren't vaccinated, please think about going to get vaccinated and get that shot in the arm.
All right, thanks for all your good info today. All right, and thank you all for being with us today. I know it feels a little different without Dr. Stites here, but he will be back next Wednesday. But tomorrow, we are going to meet Brian Mann to see if he kept off his 80 pounds during the pandemic. We've also got a great dietitian we're going to talk to, so we will see you tomorrow.
It finally clicked. If you eat this, this is what you get. If you eat something else, then this is what you can have.